Welcome back to No More Cavities. Today we will be discussing injuries to primary teeth and their management. So, starting, the first type of injury is crown fracture. We discussed in our previous lecture that what is a crown fracture involving a crown, but first we will be dividing it in complicated and non-complicated. So, the first type of injury is crown fracture. Dividing it in complicated and uncomplicated. What is complicated? Obviously, along with enamel and dentine, the pulp is involved. And uncomplicated, it means that the only enamel and dentine are involved without exposing the pulp. So whenever there is a complicated type of injury, the treatment of choice is extraction, because your pulp is involved and you cannot leave it like that. You have to do extraction. The treatment of choice actually is extraction. But if the patient age is so the permanent teeth is about to erupt in 5 years or 6 years, if there's a lot more time and you want to save the tooth, then you can go for root canal or pulp extirpation. You will remove the whole pulp. If you are going for root canal, then you will not use GIC that we use in permanent teeth or in adults. We will use zinc oxide eugenol. Why are we not using GIC? Because it will not resolve, while zinc oxide eugenol will resolve with time, as the primary tooth will resolve, the root will resolve. The material will also resolve along with the root. So this is the management of the complicated type of the fracture, that if there is involvement of the pulp, you have to do extraction, which is the treatment of the choice. But if you are opting to save the tooth, then you can also perform root canal or pulp extirpation. If we come to the uncomplicated type of the fracture, then we have two possibilities. What can we do? Obviously, the pulp is not involved. We have not to perform any kind of invasive procedure. We will simply do two things. Dividing. If the enamel is a lot more involved, then we will go for composite restoration. If not, and the injury is not so severe, then we will smooth the sharp edges. Smooth the sharp edges. So the first injury was the crown fracture, that we divided in complicated and uncomplicated. The complicated means that there is involvement of the enamel dentine along with exposing the pulp. So the treatment of choice was extraction. We will also go for root canal and pulp extirpation. And the other type of injury is uncomplicated, which means that there is involvement of the enamel and dentine, but the pulp is not involved. Then we will opt for either composite restoration, either for smoothing the sharp edges. This was the first type of injury. The second type of the injury is crown and root fracture. The treatment of choice is extraction. You can't do any other thing. If there is root involved and crown involved, you have to extract the tooth, otherwise it will damage the permanent tooth. Then the third type of injury is the root fracture. There's only root fracture. There's no involvement of the, if this is our tooth, then there's only involvement of the root. The crown is perfectly fine. There's either this type of injury or this type of injury. We divided it in coronal, middle and apical parts. So the only root is involved. There's no involvement of the crown. The crown is perfectly fine. For the root, we will see that either there's displacement or no displacement. If there is no displacement, we will keep the tooth in under observation. If there is no displacement. But if there is, the tooth is not moving, but the coronal fragment for example, this is a tooth. There is no displacement, the tooth is in position, perfectly fine. But the coronal fragment is non-vital. Coronal fragment is non-vital. Non-vital, and it is symptomatic. You have pain, and the tooth is also the coronal fragment is only non-vital, but there's no any displacement. What will you do? You will just remove the coronal segment because it was non-vital, it was symptomatic. You will just remove the crown portion. You will leave the apical portion because it will resolve by its own self. Normally, when there's primary teeth and any kind of primary teeth have to resolve and exfoliate. So if you will leave the root portion, it will resolve by its own. So the third type of injury is root fracture, which we divided in displacement and not displacement. The tooth is not. If there is no any kind of displacement, we will keep it in under observation. But if there is no displacement, but the coronal fragment is symptomatic and non-vital, what will we do? We will remove the coronal portion. Then come to the displacement. If there is displacement in mobility, we will remove the coronal portion again. Only coronal fragment. Why? Only coronal fragment will be removed. Because again, the root will resolve by its own. So this was the third type of injury. These all were the hard tissue injuries. Now we will discuss the management of periodontal injuries in the primary tooth. The first periodontal injuries. The first is concussion, which we discussed that there will only be tenderness on percussion. Concussion always is noticed when there is change in color. Whenever there is discoloration, concussion is noticed. Till then, concussion undergo unnoticed. Then the second type of injury is subluxation. What was subluxation? There will be only loosening, but no displacement. So in subluxation, what we will do? We will decide the management on the basis of mobility. So if there is slight mobility, if there is marked mobility. In marked mobility, what we will do? We will go for extraction. And in slight mobility, what we will do? We will go for soft diet. And we will clean the traumatic area. This will the soft diet will be for 1 to 2 weeks. 1 to 2 weeks. So And the second type of periodontal injury was subluxation, which means that there is loosening but there is no any kind of displacement. We will go decide on the basis of mobility, the degree of mobility. If there is slight mobility, we will go for soft diet and we will clean the traumatized area for 1 to 2 weeks. And for marked mobility, we will go for extraction. You have to extract the tooth. Okay. Then the third type of periodontal injury is extrusive luxation. Extrusive luxation means that there is partial displacement. There is displacement, but the displacement is partial. What we will do? We will do extraction. Then comes the fourth type of injury, which is lateral luxation. What was lateral luxation? Lateral luxation was that the tooth is moving in all direction laterally, in this direction, but it is not moving axially. It is not moving towards the alveolar bone. What will the injury be called if it is moved axially? It will be intrusive luxation. So in lateral luxation, we have to say that where the crown and root are going. If the crown is going buccally and the root is going palatally, for example, this is the buccal side, this is the palatal side. If the crown is going buccally, crown is going buccally and the root is going palatally, then we have to extract the tooth, because the crown is going buccally and the root is going palatally. If the root is going palatally, it will harm the permanent successor, because the new tooth gem is coming from there. So if the root is going palatally, we have to extract the tooth. But what will be the management if the crown is not going buccally but it is going palatally and the root is going buccally? The crown, this will be reversed. The crown will be going palatally and the root will be going buccally. What will be the treatment in this case? In this case, the root is away from the permanent tooth gem and we will go for conservative treatment. We will not extract the tooth as we were doing when the root is going palatally and the crown was going buccally. If the root is going palatally, we have to remove the tooth because it will damage the permanent successor. The root is going palatally but the crown is present buccally, we have to remove the tooth because it will damage the permanent teeth. But if the root is going buccally, we will go for conservative treatment until the occlusion is not gained. What is the condition here for going for conservative treatment? That the occlusion should not be gained. Now the intrusive luxation. What is intrusive luxation? That the intrusive luxation. Intrusive luxation means that the tooth is moving axially. It is moving inwards into the socket, into the alveolar bone. In intrusive luxation, you have to remember that thing, that the intrusive luxation is the most common type of injury. Most common type of injury. This intrusive luxation, which is means that the tooth is going axially towards the socket inside the, it is the most common type of injury, and its management will be decided like we decide on in lateral luxation on the basis of the root, that where is the root going. So if the root is going palatally, there will be the extraction of the tooth. But if the root is going buccally, then there are chances of re-eruption, that the tooth will come into occlusion again. Because in intrusive luxation, you will see how the tooth presents like that. These are normal tooth, and this is intrusive tooth, and again normal tooth. It is towards inside, it's going axially, like into the socket. So if the root is going palatally, it will disturb the permanent successor. We have to do extraction. But if the root is going buccally, there are chances of eruption, that it will come again to its original place. The re-eruption can occur till 1 to 6 months. We have to wait till 6 months. If there is no re-eruption until the 6 months, we will go for extraction, because if we will not extract the tooth and re-eruption is not occurring, then there are chances that ankylosis will occur. So we have to prevent the ankylosis, and we will go for extraction. The sixth type of injury is avulsion. We already know that avulsion means completely out of the socket. So when a tooth is out of socket, you cannot replant it back. But this is only for primary teeth. If a primary teeth is avulsed, it is out of the socket, you cannot replant it. But if it is permanent, you can. So what will we do if we cannot replant? We will leave it. That's all about the injuries regarding primary teeth. Thanks for watching.